Hi, I'm Gibson, Walid Saliba, talking to you about new advances in the Watchman technology. Dr. Saliba, of course, is the director of the Atrial Fibrillation Center at Cleveland Clinic. If you had to make a tweak or change to the Watchman technology, what would it be?
Thank you for having me, Mike. So the left atrial appendage occlusion, specifically with the Watchman, is a new technology, and like every technology, when we start using it, we are faced with challenges. Some of those challenges are device-related thrombosis, which occurs in 2 to 6% of the cases, as well as leaks. The new generation, or the Watchman FLX, has addressed some of these challenges, but we are still faced with the incidence of the device-related thrombus of around 1 to 2%. And this is important. Why? Because the reason why we're putting those devices in patients, like somebody comes in with intracranial bleed and GI bleed, and they're required to have oral anticoagulation, but they cannot. You put this device for the purpose of removing oral anticoagulation. And now you're faced all of a sudden with clot on the device several months later, and then you have to re-challenge them with oral anticoagulation. That's fairly deceptive for the patient as well as frustrating for the physician. So one of those changes is really to get to a technology that reduces the incidence of device-related thrombosis and the need to re-challenge with oral anticoagulation.
So you have an idea, you're going to reduce the device-related thrombosis. How do you test it out?
Well, so the next generation device that was designed to coat the fabric or to treat the fabric, the mesh fabric that is on the device, to make it, let's say, less thrombogenic. That has the potential in some of the studies that were done to reduce the device-related thrombus in these patients. And this was tested in vitro and in vivo. In vitro, it's very simple. You put the new device, the coated device, let's call it the next generation Watchman device. You put it in flowing human blood that was given by volunteers over a period of 2 hours or 4 hours, and you watch for thrombus formation. And clearly in vitro, it was shown that the coated device has less incidence of thrombus formation, or less of the surface of the device is covered with thrombus as compared to the current Watchman FLX. And again, this is not on any this is no anticoagulation used. The in vivo model is a canine model. Where got 12 dogs, 6 implanted with the classic Watchman FLX device, the other 6 implanted with the next generation device, and looked at TEE at 14 days, 28 days, and then necropsy at 45 days, specifically looking at clot formation and endothelialization of the device. And clearly, what we have seen is that at 14 days, the current, and by the way, I need to mention that those canines were not given any oral anticoagulation before, during, or after the procedure. So it is a very challenging model. And at 14 days, the current Watchman FLX device had clot formation on all of the devices, but to a greater extent compared to the next generation device. So there was less clot formation at 14 days. Now, what's interesting is that at 28 days, the TEE showed absolutely no clots on the next generation device, whereas on the current Watchman device, 3 out of the 6 still had clot formation on them. And when you look at it at 45 days at necropsy, the next generation device did not have any clot, and there was a mature white membrane endothelialization covering the surface of the device that is well apparent, whereas on the Watchman FLX device, not all of them had that membrane, and 3 out of the 6 still had persistent clots on top of the device. So clearly an advantage for the next generation coated device in terms of decreasing thrombus formation, again, in a model where no anticoagulation or antiplatelets were given to those canines. And that is very encouraging.
That is very encouraging. Wally, what struck me was the fact that you still had good endothelialization, that white coating across the device, with the reduction in thrombogenicity. Usually those two kind of compete with each other. Talk to us a little bit about how you're going to achieve both goals.
Sure. So definitely the concern was that if you reduce thrombus formation, then are you going to affect endothelialization and are you going to affect the maturation of the device? Because eventually that's what you want at the end of the day. And then you need to have some kind of thrombus formation to start that maturation process or that endothelialization process. And it appears that the treatment of the fabric is not necessarily by itself eluting a drug that is antithrombotic or what have you. I think the treatment of the fabric makes it so that it enables a thin layer of laminar thrombus to form, but without going through the full cascade of that uncontrolled thrombus formation that we see currently in the current devices. So at least that's what the theory is. And I know that there's going to be some presentation in the next few meetings on some of the mechanisms, molecular and proteomics, about how this is done and why is this happening.
Well, that's fascinating. I look forward to seeing that. Did you check any other biomarkers? I mean, we're looking at things visually, clot, necropsy. How about some blood tests?
Sure, and that's a very interesting question because we're going to dive a little bit into the mechanistics and what is the theory behind that. So we checked D dimers levels at baseline and again at 14 days and at 45 days. And as you know, D dimer correlates with the breakdown and formation of clot, and also is an acute phase reactant. So it does go along with the inflammation, which is something that's going to be important down the road. And we have seen that actually at 14, the level of D dimer is actually increased more so in the canines who had the regular WATCHMAN FLX as opposed to those who had the next generation WATCHMAN device, which correlates with the thrombus formation actually in the canines who had the regular WATCHMAN compared to the WATCHMAN FLX. So that is also something that will be important when we start talking about mechanisms down the road.
Fascinating stuff, Walid. Thanks for joining us today. Thanks for the update. Look forward to seeing this out there in publication and any more details about that compromise between endothelialization and reduced thrombogenicity. Thanks for joining us, and thanks to all of you for joining us for this update.
Thank you very much for having me.